Good morning, good evening, good night, doctors, nurses, and pharmacists. I'm Dr. Che, and today we will write a letter. We will discuss some writing case notes that were written by myself. Okay, so these case notes are written by myself, so we will discuss them together. First, we will discuss how to write it, and then we will see I will mark your letters for both doctors and nurses. Okay, so if you can hear me, just let me know, please. Okay, let us just wait a little bit for other people to join and then we will start. Good morning. Okay, just waiting for other people to join. Okay, and then we will start. So we will first discuss this letter, how to write this letter about epilepsy that I have sent my own case notes. So then we will write the letter. Okay, just let me share the session with other doctors and nurses and then we will join. We will start, okay? Okay, so please just let me know in the chat about your profession, if you are a doctor or a nurse. Okay. Okay. So, okay. Can you see in my case notes on the screen? Can you see my case notes on the screen? Okay, so yes, okay. Just give me 1 minute to see a patient. I'm coming back. So just read the case notes if you have not done already. Okay, sorry, I needed to see a patient. So now these are the case notes that can be used for both doctors and nurses, because in the real exam, the main thing is, how to write the letter. Okay, so how to organize the information, so how you can communicate easily with other doctor or nurse in the in the written form. So this is what they want you to do. Okay, so okay, so this is the letter. Can anybody tell me what kind of this letter is? Because no, just let us read. Okay, let us read. So you are a doctor or nurse at this town, this clinic. Read the case notes below and complete the writing task which follows. Okay, so after reading this part, just we need to do it very quickly. What we should do? We should keep reading this part, or we should go somewhere else. What we should do now? So I have read this part. This part. Now I should go to patient details, past history, social history, visits, or I should do something else. What should I do now? What should I do now? Okay. What we should do now? We should read the writing task. Okay, we should now read the writing task. Yeah, read the question, read the task. After this, we need to read the task. All of these things we need to do within 5 minutes. This is our 5 minutes reading time. All of these things we need to do in 5 minutes, in 5 minutes reading time. Yeah, go to the task. So we will see which type of letter this is. This is whether this is a discharge letter, referral letter, transfer letter. Okay. So urgent referral letter. So there are different types of letters. So we need to see which type of letter is to whom we are writing is also important. So let us see here in the writing task. Okay. Using the information in the case notes, write a letter to this doctor. So these are my own case notes. So for review of medication and treatment plan. So this is the name of the doctor, Dr. Che, consultant neurologist. Okay, Bradford Hospital. These are the things. Okay. No, my question is from this task, what you have read, what you think, which kind of letter it could be? Okay. You can see the plan also. In the plan is written refer to neurologist for review of medication. Continue taking medication until review with neurologist. So this is the advice that we have given to the patient. So what do you think, which kind of letter this is? Normal referral, urgent referral, discharge letter, referral letter, but what kind of referral? There's normal referral and one is normal referral and other is urgent referral. So what do you think? What kind of letter this is? Urgent referral. Okay, let us see in the case notes, but overall, this is a referral letter. Okay, it is not clearly mentioned so far. So it is a referral letter, and we can see what we want from the reader. Okay, looks like normal referral, and we need to see what we need from the reader to do for this patient. So can anybody tell me what we need from the reader to do for this patient? So as you remember, in the purpose, we need to write two things. Number one, what is wrong with the patient? Number two means the diagnosis of the patient. And number two, what we want from the reader. Okay, so we write two things in the purpose. So number one, what is wrong with patient? Okay, what is wrong with patient? Number two, what we want from the reader. Okay, to do for this patient. So these are two things that we write in our purpose. Okay, purpose is just these two things. Number one, what is wrong with the patient? What is the diagnosis of this patient? And number two, what we want from the reader. Okay, so can anybody tell me from the part that you can see from this part, what you think, what we need from the reader to do for this patient? What we need from the reader to do for this patient? What we need from the reader to do for this patient? Review of medication, very good. Okay, so we need review of medication means further treatment, review of the medication, further treatment. Okay, so this is what we need from the reader. Okay, so we need review of patient's medication, but still we don't know why we need any review for this patient. Okay, review, very good. Review and treatment plan, but we can make it, appropriate, later on. So what exactly we need to write in the purpose. Now let us read because now this is 5 minutes reading time. Let us read, okay, the case notes. This is the name of the patient, Sophia and Jenkins, and we will use title Mace, is female. This is the date of birth and this is the age. Social background, she is married, lives with parents, and work is a teacher at DrChe Institute, and hobbies is swimming and dancing. Okay, these are the hobbies of the patient. No past history, smoking, no, drinking, no, allergies, no, no surgeries, childhood eczema, yes. Then we have allergic rhinitis since childhood, takes loratadine, 1 tablet daily. Then we have history of bacterial meningitis in June 2021, and which needed treatment with antibiotics. We have family history of epilepsy. We have family history of epilepsy, and we have history of lung cancer in the mother. So this is just past history, social history, all of these things. So then what do you think? We should continue reading or we should do something else? What we should do here now? We should continue reading or we should do something else? What do you think? We should continue reading or we should do something else? We need to see the dates of visits. What we need to see? The dates of visits, because it is very important for us. The dates of visits are very important for us. Okay, dates. Okay, let us see the dates. This is 20 of month September 2029, 2022. This is the first visit. Then we have second visit 11th of October. Then we have third visit is 11th of November. Okay, so how many visits we have in this letter? How many visits we have in this letter? First visit, first patient came on 20 of September. Then second visit is on 11th of October, and next visit on 11th of November. So how many visits we have in this letter? 3 visits. So we have 3 visits in this letter. Apart from that, what we need to see the difference between visits. Okay, mean how much is the difference? This is in September, next is in October, and next is in November. So all the visits are within 2 months. This is today's visit. So all the visits are within 2 months. Okay. This is very important to remember. Very important, because just imagine if the first visit is 1 year ago, then second visit is 2 months ago, and third visit is today. Third is today. In this letter, if there is one visit 1 year ago, then next visit is 2 months ago, you need to be very careful about this visit that was 1 year ago. Why? Why we need to be very careful if the visit is a little bit, far away? The reason is this could be irrelevant visit. This could be irrelevant visit. This one, that is 1 year ago, it could be irrelevant. So we need to be very careful. Yeah, old history. For example, 1 year ago, patient had symptoms of, flu. You can write cold. Okay. Then 2 months ago, patient presented with fits. And today, patient presented with fits again. Okay. Plus fever. Now, what do you think? This visit, first visit, is relevant or irrelevant in this letter? If you have a letter in which first visit was 1 year ago, patient presented with flu, cold, and you have given like paracetamol to the patient, and patient went home. Then patient came to 2 months ago with fits, and then patient came today with fits again and plus fever. So what do you think about this visit of that is 1 year ago? What do you think? Is it relevant or irrelevant? Second and third are relevant. So if second and third are well relevant, and what about the first one? Is it relevant or irrelevant? Irrelevant, okay? Is irrelevant. Okay. Now, if as examiner, if as an examiner, I am marking a letter of any doctor, any nurse who includes this visit. So who include this visit, who includes this visit in his or her letter, what do you think? What score I will give? If he's a doctor, will get C plus. If he's a nurse, will get C grade, okay? The reason is because you don't need to include this irrelevant visit, okay? This is very easy for the examiner to, separate the students who are not well prepared just by seeing that they have included this irrelevant visit in their letter. So definitely this student, even if their English is very, very good, but still this student will get, if it's doctor, C plus, if it's nurse, C grade, okay, C grade. Be very, be careful, okay? Be careful about these things. Okay. So, but here our visits are very close, and let us see what is in each visit. In the first visit, patient is coming with fit, presents with fit, some visual auras 5 minutes before fit, auditory auras of ringing sounds 3 minutes before fit, and the fit lasts for 3 minutes. Jerky movements. How was the fit? There were jerky movements. Both arms and legs. Loss of consciousness was positive. Patient wets himself, herself. Okay, it should be herself. Is female. Okay, herself. Pass urine. Bites his. No, it should be her. Okay, just these are the case notes written by me, and we need proofreading. Okay, so bites her tongue, and then mother calls ambulance and brings the patient to the emergency department. So we have done the examination. Saturation is 99%, blood pressure is okay, respiratory rate is okay, pulse is okay, systemic examination is okay. We have requested some investigations for blood count, liver function tests, urine electrolytes, renal function test, EEG of the brain, CT scan of the brain, and we have advised the patient to come after 3 weeks to review in 3 weeks. Okay. So this is our first visit. In the next visit, patient came for, of course, for a review. And patient complains of episodes of similar fit 1 week after first fit. It lasted for 5 minutes. They called the ambulance and the treatment was given diazepam, 10 milligram IV. Then we have labs. These tests that we have, advised here, we have requested, we have advised, we have ordered here. So here are the results. All blood tests are normal. MRI is normal, no growth, no mass. EEG shows paroxysmal bursts of rhythmic high amplitude spikes. It could be spikes, okay? The diagnosis on that time was tonic clonic idiopathic epilepsy. Then you have given the treatment, sodium valproate. You advise the patient to stop driving. You advise the patient to avoid loud noise. You advise the patient to avoid flashing lights, avoid working on heights. And we advise the patient to regularly review with his or her GP. Now we have third visit. Okay. Patient today came with loss of appetite, fever, yellow discoloration of skin and eyes, pale stool, dark urine for 5 days, and no fit since last visit. Since this visit, there is no fit. Investigations, bilirubin is increased, CBC platelets are decreased. Patient stops medication 2 days ago. So patient stopped medication and assessment is side effects of sodium valproate. Okay, these are the side effects possible this patient is experiencing now. Now the plan is we need to refer this patient to the neurologist for review of medication, and we advise the patient to continue his medication. He has stopped, so she has stopped. We advise the patient to continue the medication. So in this letter, we have so we have purpose. We have first visit that is on 20 of 09. Second visit was on 11 October. Third visit is 11/11. Then we can write a little bit about, past history. Past history, you can say social history. Okay, past history. Then we have conclusion. This is one way. Other way is that you can say this one is today's visit. Okay. Other way is we can write after purpose today's visit, then first visit, second visit, past history. So this is number 2, method number 2. Okay. And this is number 1. Okay. In number 1, we are writing in chronological order. We are writing first visit, second visit, third visit, past history, social history, then conclusion. And second, we are writing purpose, then third visit, first visit, okay, second visit, past history, conclusion. So what do you think? What is appropriate, number 1 or number 2? What is appropriate for this letter? What is appropriate for this letter? Number 1 or number 2? Which order? Chronological order, order of importance. Chronological order or order of importance. What is important here? Which one? So we should follow order of importance or chronological order. This is not an urgent letter. It is not written anywhere. It is not written anywhere in the letter that this is urgent letter. So this is normal referral letter. So we will follow chronological order. Okay. So we will follow chronological order. Chronological order. Okay. So we will write like this. We will write purpose. We will write, first visit. Then we will write second visit. We will write third visit. We will write past history, and we will write conclusion. So as you can see from the notes, on the first visit, patient is presenting with fits. That is relevant. Okay, this visit is relevant. Second visit, patient came for the review of the test results. So this visit is relevant. So third visit is also relevant. So all the visits are relevant. Now let us decide about patient details, name, gender. These things are not needed. Is married, lives with parents, work at this institute. Hobbies are swimming and dancing. So do you think any of these things are important to mention in this letter? From the social background, is anything important to mention? From the social background, do you think is anything important to write in this letter from the social background? What do you think? So Miss Priya or Dr. Priya is saying no. Miss Rafia, Dr. Sam, Dr. Naveen are saying hobbies could be important because, but this is, mainly the reason is side effects of epilepsy medication. So even hobbies could be relevant, optional. I will say them optional, but we can skip. This is a referral letter and is not something, for the first time is not, he is not going to diagnose anything. The reader is not going to diagnose anything. So I would prefer to skip, okay? Social history, nothing is important. If you write hobbies, I will not say it is wrong, but you can skip, okay? Then smoking, no, drinking, no, allergies, no, these things are no. What about childhood eczema? We should write childhood eczema or not? Childhood eczema. What do you think? Living with parents, yes, you can write, but no, according to the situation, it's not too important, okay? We are not, discussing something, that is social. Just this is like a medical referral, okay? So childhood eczema is not important. Excellent, okay? Good. No, no need of eczema. What about allergic rhinitis? What about allergic rhinitis? Since childhood, takes loratadine 1 tablet OD. Is also not important. Okay. Even currently patient is taking medication, but still it is can be, but does not look very important. Bacterial meningitis in June 2021 and was treated with antibiotics. What's about this? What about this? What about bacterial meningitis? She's taking medicine, but according to the situation, we can skip. Okay, Miss Saima. Uh, we can skip. Okay, it's not too important. Okay, history of meningitis could be important because this could be the reason. Yeah, okay, you can mention it. You can mention it. History of bacterial meningitis. You can mention it. Further, the history of epilepsy. What do you think? Mother's history of lung cancer is not important. Father's history of epilepsy and these meningitis could be, could be, could be. Okay. But let me see, let me tell you the situation. Okay. Let me tell you the situation. This patient is not, if we are sending this patient, let me see if this patient had some fits. We are suspecting epilepsy. Okay. Then, a history of meningitis plus father's epilepsy. Okay. So these are important. But in this case, is already diagnosed, with, EEG and the symptoms. Okay. This case is already diagnosed. So these are the just risk factors. So if this is a new patient for whom we don't know the diagnosis, or we are referring this patient for a definitive diagnosis, then we must mention this. Okay. If we are sending this patient for diagnosis, but here, okay, but here this patient is already diagnosed with tonic-clonic idiopathic epilepsy in the second last visit. This patient is already diagnosed with tonic-clonic idiopathic epilepsy in the second last visit. So now the problem is just patient is having some side effects of the medication that we have prescribed in the second last visit. So do you think telling the reader that father has epilepsy, this patient had meningitis 1 year ago, is relevant now? The purpose is just to review the medication because we have diagnosed the epilepsy. We have diagnosed the epilepsy and we are just telling the reader to review his medication. The diagnosis of epilepsy is already done in the second last visit. Now tell me, would you write father's history of epilepsy and history of meningitis that was 1 year ago? Would you write it or you will not write it? These two parts, these two things. Will you write in this letter or not? Will you write or not? Okay, so next. Now you have here the diagnosis. In the previous visit, you have the diagnosis for today. You have what we need from the reader. Can you write a purpose just quickly? I'm going to see a patient in 1 minute. I'm coming back. Please note, I'm coming back. I need to see a patient. I am coming back in just 1 or 2 minutes only. So just see how you will write the purpose. Okay. Just see how you will write the purpose. I'm coming back. Okay. And you can try to write in the chat. Okay. Okay, so now let us try to write the purpose. Okay, first part is very easy. So here we have Dr. Nadim's purpose. Okay, and here Dr. Sema or Miss Sema, yours. And here we have Miss Archie's. Okay. Okay, before we see yours, okay, let me try to write here the purpose, okay. First is very easy. We can start with I am writing to refer. Thank you for seeing. So both are okay. At the basic level, I would prefer I am writing to refer, okay. Then we need miss as it is written in the case notes, miss. And with miss is title, we will use surname of the patient. Surname means the second part of the name, okay. Miss Jenkins, okay. I'm writing to refer Miss Jenkins. You can write the age, 27-year-old female, okay. You can write, okay. But let us just skip because we have already written, okay. So then what is wrong with this patient, okay? What is wrong with this patient? We need to write. So we have two things here. If you see here, in the last visit was tonic-clonic idiopathic epilepsy. And on today, we have side effects of sodium valproate. Okay. If I write like this student has written the last one that I can see. Rafia. Okay. This one. Let us read this one. Okay. I'm writing to refer Miss Jenkins, 27-year-old. First of all, there is a mistake. Okay. We need hyphens. When this is followed by a married lady, we need to use hyphens. Okay. Just let me copy here and then I will. Okay. So we need here hyphens and year should be without S like this. A 27-year-old married lady. No is correct. Okay, then we need we can use comma here and who has been diagnosed with epilepsy. Okay, who has been diagnosed with epilepsy is okay. She requires further review of medication and treatment plan. Oh, no, if you see this letter, this purpose, is it clear from the purpose that what we want from there? Why we are sending this patient? Okay, she has epilepsy, but why you need a review of medication? I will ask. Okay. So you are sending this patient to me. You are writing this letter to me. Okay. So I will say, okay, this was written by Rafia Mahmouda. Okay. Dr. Rafia Mahmood or Miss Rafia Mahmood or whatever. Okay. So I will ask you, okay, this patient has epilepsy. You are the GP, you are the nurse at GP clinic. There is a doctor in the GP clinic. So maybe you are yourself a doctor there or you are a nurse there. But she has been diagnosed with epilepsy, but no, why you want review of medication? Why? Why? So is it clear the situation in the purpose? Is the situation clear in the purpose? So why you are sending this patient to me? Why you cannot treat there in the GP clinic? Why? No. No, you need to mention the current issue, the latest issue. Okay. So what is the latest issue of the patient? Even this is the diagnosis. This is the diagnosis, tonic-clonic idiopathic epilepsy. But what is the latest issue of this patient? What is the latest issue of this patient? Yes, this is the issue that you have written in the comments. So patient is having some side effects of the medication. We don't need to mention the name of medication in the purpose. Okay. So now let us see here if any of them has written something similar. So this is Dr. Nadeem's and okay. I'm right to refer Miss Jenkins, who has been possibly suffering from, why you are making it too, a little bit difficult, Dr. Nadeem. Just make it easy. Who has possible, okay? Suffering from is mostly not liked in your this exam, okay? On your OET exam, okay? Side effects of anti-epileptic medication, that is okay. This part is okay, but this part you need to make a little bit. I would highly appreciate this type of language we mostly use in the, in the conclusion. Your review of her medication and treatment plan for the treatment plan would be highly appreciated. Just you can only write review of medication, okay? So don't say who has features consistent with tonic-clonic. Okay, these are features consistent with tonic-clonic epilepsy, but why you are sending this patient to me? Why? It is not clear why. I'm ready to refer Ms. Jenkins, who has been diagnosed with tonic-clonic epilepsy, but why you are sending this patient who has tonic-clonic epilepsy, tonic-clonic epilepsy, but why you are sending this patient to me? Okay. So this part we need to make it clear, okay? I'm writing to refer Ms. Jenkins. Okay. So then we can write who has side effects due to epilepsy medication. Okay, who is experiencing, who is experiencing side effects of anti-epileptic medication. Okay, like this. Your review of her medication would be highly appreciated. So this is very easy to write. Okay, let me show you what we have done here in the model answer. Okay, so I'm writing to refer Ms. Jenkins, who is experiencing side effects of her epilepsy medication. So I have mentioned that she is epileptic. When I am writing her epilepsy medication means she is epileptic. Who is experiencing side effects of her epilepsy medication. Your further assessment and review of her medication would be highly appreciated. Okay, clear? This is one of the difficult parts in your letter to write. Okay, so now we have second part. So we don't need to write anything from social background, part history, family history. These things are not important. Okay, so now let us move to first visit. Okay, if you write each and everything in this visit, your letter would be long. Okay, would not be concise. And if you see here with fit, this fit was preceded by some auras which lasted for 5 minutes. There were auditory auras, visual auras, auras, and in auditory auras, there were ringing sounds 3 minutes before the fate, and the fate itself lasted for 3 minutes. What was the fate? There were jerky movements of both arms and legs. Okay. What else? There was loss of consciousness. What else? Patient wet herself, okay, himself, no, herself. She bites her tongue and she called the ambulance. Okay. So now if you see here, all of these things are about the fate. Okay. Yes, Miss Veroni, who has been recently diagnosed with epilepsy and has possible side effects of sodium valproate. This is also okay. Miss Veroni, the way you are written first part of the purpose is also okay in the chat. You people can see in the chat. By the way, she is one of the VIP hybrid course students. Okay. So now the problem is there are a lot of things. Okay. There was a fate. There were visual auras before the fate. There were auditory auras of ringing sounds 3 minutes before the fate. The fate itself lasted for 3 minutes. There were jerky movements of both arms and legs. There was loss of consciousness. The patient wets herself, bites her tongue. Mother called the ambulance and brought her to the emergency department. Examination is normal. We have, done some investigation and we have done a review after 3 weeks. Even I can write a little bit about what treatment we have given. But anyway, the thing is that just write what is written there. Okay. So what is the main issue? First issue was how to organize the letter. So you have decided to write purpose, first visit, second visit, third visit, and social history is not needed here. Then you will write the conclusion. Oh no, in the first visit, the problem is there is a lot of information about. Yes, if you write all the visits, if you write everything, each and everything, your word count would be above 300. That is true. Okay. So what we need to do? So if you write about the fate, on this day, the patient presented with a fate. Okay. It was accompanied by visual aura that lasted for 5 minutes and also auditory auras of ringing sounds 3 minutes before fate. The fate lasted for 3 minutes and there were jerky movements of both arms and leg. Patient also lost consciousness. He wets herself and bite her tongue. Mother called ambulance and brought her to the emergency department. So if you write each and everything and you write like this, the way it is written, definitely you will get 500 out of 500. Okay. No doubt. There is no doubt that you will not get 500 out of 500. Okay. So if you write like this, on this day, Miss Jenkins presented with a fate. It was preceded by a visual aura that lasted for 5 minutes before fate, and auditory auras of ringing sounds that lasted 3 minutes before the fate. The fate lasted for 3 minutes, and there were jerky movements of both arms and legs. Patient lost consciousness, wet herself past urine, and bit her tongue. Her mother called the ambulance and brought her to the emergency department. So what should be your score? Can you write in the chat 500 out of 500, okay? If you write like this, excellent letter, okay? Excellent letter. So the main thing in this visit is here you can just write, his examinations were normal because everything is normal, okay? Everything is normal. And here you don't need to write the names of investigations because in the next visit you will be discussing, their results. So here just write some relevant investigations were ordered, okay? Some relevant investigations were ordered. That is enough. Now the problem is how you will organize. Okay, this is the technique. Okay, this is the fit, and this is the fit itself, how it was. Okay, jerky movements. So instead of fit, just you can write on this date, Miss Jenkins experienced jerky movements of her both arms and legs. Okay, preceded by auditory and visual hallucination. Okay, you can mention a little bit about the duration. And the accompanied symptoms, loss of consciousness, okay, pass urine and bit her tongue, you can write in a separate sentence. Just to save your time, we can write it as, as the new because it would be too long class because already we have, been in the class for 1 hour. So now, just let me show you what I have written so you can easily follow. So this is the organization. You need to be careful about the organization. Organization is not only how to organize the paragraph, organization is within the paragraph also. So what mostly the nurses will do, they will write like this. Patient presented with this and this and this and this. So they will just copy and paste all the things here. But this is not the how we write the medical history, okay? Initially, on this date, Miss Jenkins presented with a complaint of a fit. Okay, complaint of a fit with jerky movements. What was the fit? With jerky movements of her extremities. You can see I am not writing legs and arms and legs. Okay, we can of her four extremities, of her all extremities, just extremities. Or you can write legs and arms also. That's not something very. Okay, so with a complaint of a fit with jerky movements of her extremities, which lasted for 5 minutes. So it lasted for 5 minutes. This is a fit. Okay, I'm writing about the fit. It lasted for 5 minutes and was preceded by auditory and visual auras. You can see. Do you understand? Just write something in the chat so that I can see that you people are participating actively. Do you understand how to organize within the paragraph? So there was a fit. How was the fit? With jerky movements of her extremities, and this fit lasted for 5 minutes. I don't know exactly is 5 minutes or 3 minutes. Okay, 3 minutes, not 5 minutes. Okay, uh, for 3 minutes. This lasted for 5 minutes and was preceded by auditory and visual auras. So I don't need to write the detail of this auditory aura was ringing sounds and it was 3 minutes before the fit. You don't need to give this detail. Okay, you just need to write. Okay, so Miss Jenkins presented with a complaint of a fit with jerky movements of her extremities, which lasted for 3 minutes and was preceded by auditory and visual auras because before this fit, she had auditory and visual auras. So very concisely. Okay. Now we have some related symptoms apart from this. Patient lost consciousness. Patient wets herself, okay, and bites her tongue, okay, is her hair, not his. So you can write a one sentence here. She also, why, the thing, please note here, can anybody tell me why I am using presents? This is a past visit. Why I'm using presents? I am using vets. I'm using bytes. So why I am using present tense here? Why? Even it is a past visit. Why? Can you tell me why? Can you tell me why? Can you tell me why? No, this is not fact. This is past visit. Because I wrote for at that time. Okay, very good, Miss Sama. Are you Dr. Sama or Miss Sama? I think Dr. Sama, I think so. I have your letter also with me. Are you a doctor or nurse? Sama Nahid. Explain the sequence events. No, this is at that time. I am writing at that time. Number two, yeah, Dr. Sama. Okay. Number two, the reason is because if I write at here presented, if I write here VAT, if I write here bit, okay, then you people will just copy and paste, okay. So the writer is using here just present whatever, so that the students, when the students will write the letter, they need to use past tense. If you use the same tense, you will be wrong, okay? You will lose marks. Okay. So she also lost consciousness, passed urine, and bit her tongue. Okay. So I'm using past tense. She also lost consciousness, passed urine, and bit her tongue. Next, her examination was unremarkable and some relevant investigations were ordered. Because here you can see examinations are unremarkable, nothing is abnormal, all things are normal. And these investigations, you don't need to write their names because in the next visit, you will discuss their values. What was normal, what was abnormal. So you just need to write her examination was unremarkable and some relevant investigations were ordered. Okay, so let us see the word count 51 only. 51 words for this long visit. Okay. Okay, now let us move to next visit. So, okay. So here on this next visit, in second visit, patient came for review and patient complained that she had one episode of faint. Okay. 1 week after the first fake and it lasted now more than 5 minutes. They called ambulance and was treated with diazepam. Blood investigations were normal, MRI was normal, and EEG showed paroxysmal burst of rhythmic high amplitude spikes. Tonic-clonic idiopathic epilepsy was diagnosed and patient was given sodium valproate. Okay. So here you don't need to mention what we have. No, just MRA is normal enough. Okay. And here you can stop driving, avoid loud noise, flashing lights, avoid working on heights, regular review with GP. So avoid this, avoid this, avoid this. So what you can write as concisely, what you can write instead of saying don't drive, avoid noise, avoid noise, okay, avoid flashing lights, avoid working on heights, okay, you should you have regular reviews with GP. So what do you think? Can anybody think about just something very concise? Just lifestyle, okay? You can just use lifestyle, okay? Lifestyle modifications, okay? Even you can skip. Anti-epileptic measures, yes, it could be, yeah. Non-pharmacological measures, lifestyle modifications. Yes, to avoid repetition, you can just write she was advised to do this. Okay, valproate, sodium valproate is very important. Even you should mention the dose and the frequency of sodium valproate because this is the side effect of medication. Yeah. Okay. Yeah, some precautions also. You can write some precautions. Yeah, Dr. Nadeem, good. What do you think? Can you make the EEG test concise? Paroxysmal burst of rhythmic high amplitude spikes. Can you make it concise? Can you make this part concise? Yes, health education, very good. Who is this? Is Mehola Aleta, sorry for mispronunciation. Very good. Okay, health education, very good. Okay, we can use health education. She was educated on precautions. Okay, like this. So EEG, we cannot make it concise because this is the main important thing in this visit. So what was the EEG result? Okay. So here we don't need to use, they call the ambulance. We can just write there diazepine, and so we can just mention that it was treated. You can write the diazepine, okay? So now let us see the model answer. Now the duration is a little bit more than normal. On this date, next visit, Miss Jenkins complained about a fit 1 week after her first visit, which lasted for more than 5 minutes and was treated with diazepam. Okay, just one sentence for that fit. Okay, she has been no is wrong. She was. It was in the past. She was suggested. She was suggested. So just one sentence for this. Then we will see that her blood investigations and MRI were normal. So we can make the normal things together. Instead of writing her FBC, LFT, RFT, urea, and electrolytes were normal, and MRI showed no abnormal growth or no mass was detected. Okay, no mass was detected. Okay, so if we make it wordy, we can write like this. Okay, let me try here. Okay, like this. Okay, our FBC, LFT, urea, and electrolytes were normal, and her MRI showed no abnormal growth or a mass. Okay, now look at this and look at this. This is called conciseness. Look at this and look at that. This is called conciseness. Okay, so here we have 19 words and here we have 7 words. 7 words here, and here we have 19 words. Okay, do you understand? Please write something in the chat. So you need to participate actively. Okay, I cannot just keep speaking with myself. Okay, so do you understand the conciseness? So both the things are normal. ECG means blood investigation. These are blood investigation. These are normal. And here is MRI. Both are normal. I don't need to write normal separately for blood investigation, then normal separately for MRI. Okay, this is conciseness. This is where you will get marks. Okay, anybody can tell you, sentences and tenses and this and that. You will learn from any class. Okay, there are a lot of people who can teach a lot of things, but these are the tricks that will easily help you in the real exam. Okay, her blood investigations MRI were normal, very easy to understand. Believe me, this is not IELTS exam where you need to use any high level of English. In this exam, you need to make things concise, easy, and clear for the reader to understand. What I said? You need to make things easy, clear, make things easy, concise, clear, and easy to understand for the reader. If you can do that, you will get a good mark. You will get good score. Okay. Okay. Concise, clear, and easy for the reader. Then you will get good marks. Otherwise, you will write, even your English is very good, you will not, okay, get good marks. Okay. So then her blood investigations and MRI were normal, but now let me show you one thing. You can see this is one sentence or two sentences. Can you tell me? This is one sentence or the two sentences? This one is one or two sentences? This is one sentence or two. Please write something in the chat so that we can just make it interactive session. Okay. Is one sentence or two? One sentence. Which type of sentence this is? Simple, compound, complex, or compound complex? Which type of this sentence is simple, compound, complex, and compound complex? Which type of sentence this is? Which type of sentence this is? Simple, compound, complex, compound complex. This compound sentence. Okay. Compound. Okay. Okay. So okay, now look at the second. Now I have made some changes. Her blood investigations and MRI were normal. This is one sentence. Her EEG showed paroxysmal bursts of rhythmic high amplitude spikes. Okay, it should be spikes, plural. Now these are two simple sentences. Even this is compound sentence. This one is itself compound. But I will say overall, these are two simple sentences. Okay. And there is some relation between these two sentences. This is something normal. This is something abnormal. So we have opposite effect. We have opposite relation between these two. So it is very easy for me. Just put comma here and but. This but is mean the second part is opposite. So here is something normal. So after but there would be something abnormal. Okay. Contrast. So you can see how things now, if you write like this, and then you say, oh, I got 340. If you are a doctor, if you are a nurse, I got 290. My English is very good. I don't know what happens. So this is the reason you need to think logically. Okay, good. So her blood investigation MRI were normal, but her EEG showed paroxysmal burst of rhythmic high amplitude spikes. You can see here Again, look at this sentence. It's very easy. I don't write very complex, okay, very difficult sentences. I write very, simple things, but it is very good. Tonic-clonic idiopathic epilepsy was diagnosed and she was advised to take sodium valproate, or she was prescribed, even advised to take, no. Okay, she was prescribed sodium valproate. Even we can, write prescribed. She was prescribed because there will be less words. Okay, she was prescribed sodium valproate 300 milligram BD and advised to follow. So that is why I have used advised to, because I could not write here the verb separate word here. So advised to I am using for both of them. Advised to take and advised to follow. That is why I'm using for both of these parts. So idiopathic, tonic-clonic idiopathic epilepsy was diagnosed and she was advised to take sodium valproate 300 milligram BD and follow up, okay, to advise to take and follow lifestyle modifications, or to follow precautions, preventions, okay, or you can write health education was provided. She was educated, okay, on preventions like this. You can add anything like this, okay. Then we have last visit. Last visit is very easy, but there is some technique also in the last visit. So you have loss of appetite, you have fever, you have yellow discoloration of skin and eyes, you have pale stool, you have dark urine, and you have the duration for the last 5 days. Okay, how many things we have? Loss of appetite 1, fever 2, yellow discoloration of skin and eyes 3, pale stool 4, dark urine 5, and the duration also for 5 days. So we have almost 6 things, 5 or 6 things. If somebody like me, who is very, relaxed student and not prepared for the exam, I will do like this, okay? On this day, today, Miss Jenkins presented with loss of appetite, fever, yellow discoloration of skin and eyes, pale stool, and dark urine for the last 5 days. Then I will write, her bilirubin was increased and CBC showed decreased platelets, okay? And she stopped the medication, okay, like this. What I can do, what I did when I wrote this, what I did is loss of appetite is a symptom, fever is a symptom, okay. Yellow discoloration of skin and eyes, you can consider as something like an examination. Yes or no? Pale stool and dark urine that the patient will tell you, but the yellow discoloration of skin and eyes, you can get, okay, as like the examination. So I have done is I've written yellow discoloration of skin and eyes with investigations when I am mentioning bilirubin. Okay, when I am mentioning bilirubin, I have mentioned there, okay, because bilirubin yellow discoloration is with, some relation there, okay. Today, Miss Jenkins presented with new symptoms of, even I have added one thing. It is not written in my case notes, new symptoms of. When I will write like this, it will draw the, attention of the reader, of the examiner. So some new symptoms. Oh, what new symptoms? Okay, with new symptoms of fever, loss of appetite, pale stool, and dark urine for the last 5 days. Now my sentence is easy to understand. If I add here, reveal, yellow discoloration of skin and eyes, this sentence would become long. So her examination revealed yellow discoloration of skin and eyes, and her blood tests showed increased bilirubin and decreased platelets. Easy. Please note she has stopped her taking her medication for the last 2 days just. Then social history, background history is not important. Then in view of the, I would be grateful if you could further review her medication as you think appropriate. You can add something here at the end, okay? Any question so far? Any question? So any question? Any question? No? Now let us see what you have done in your letters. As Mustarhima Inam is there. Mustarhima Inam is there. Mustarhima Inam is there because I will only mark your letter if you are in the class. Otherwise, I don't need. Okay. So this person, Mustarhima Inam, is there. Yeah, okay. Okay. Good. She is there. Okay. Okay. So, okay. Let us read your letter. First, I will see the word count. It looks a little bit not good paragraphing, but let us, as you have written in the, I think on WhatsApp, so that is why it looks like. So this is today, this is the conclusion, this is the purpose, okay? And your word count is 174, word count is okay. I am writing for the review of medication and treatment plan of Miss Jenkins. We need comma here. Who has developed some side effects of our anti-epileptic drugs. Okay, is good, is good. But what comes first? The diagnosis or what we want from the reader? I would prefer, I would prefer always to write the diagnosis first and then write what we want from the reader. Dr. Nadeem asks, can we write BD, TDS? Yes, we can use common abbreviations like diabetes mellitus, DM, hypertension, HTN. Okay, so blood pressure, BP, respiratory rate, RR, we can use, okay, but not overuse these things. This is okay, but just please follow, first write the diagnosis, then write what we want from the reader, okay. These things are not needed. I will not say it is wrong. I will not say it is wrong. I will not say it is wrong, but this is not needed. But if you want to write, is okay, I can accept, okay. Initially, we need comma here. On this date, she was, we should write name of the patient at the start of new paragraphs, okay. When we start a new paragraph, we should use name of the patient, okay. Miss Jenkins was brought by ambulance to the emergency department with a history, no, with a history of, okay. With history is wrong, okay. With a history of this and that. Tonic-clonic fit, okay. You can write jerky movement, instead of jerky movement, you written tonic-clonic fit, that is good. That was preceded by auras. We can write auditory and visual auras because we can be a little bit more specific. Auras, okay, this is a plural. Her fit was associated with unconsciousness, urinary incontinence, and tongue bite, okay, is also good. Some blood investigation as well as EEG and MRI of the brain was requested, okay. Can anybody point out any mistake in this sentence? Anybody can point out any mistake in this sentence? You want me to make it bigger? Okay. Any mistake? Any mistake? What is the mistake? Dr. What is the mistake? Were requested. As well as not wrong. We can use as well as. Okay. We can use as well as. But when we are using this, okay, when we are using this, okay, we need to some blood investigation, no, investigations, it should be plural, okay, investigations. This is not a single investigation. So investigations would be our main subject. So our verb should be according to what is before as well as, okay. Some blood investigations were requested, okay. 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 As well as EAG with brain were requested a week later on this date. If we can use one of them, though both things, don't use both of these things, just one of them. She had a similar episode of it, which was treated with IV injection, diazepam, okay. We don't need IV injection, just diazepam is enough, okay. Don't make things difficult. Her EEG revealed persistent bouts of arrhythmic high amplitude spikes with X, okay, on diagnosis of, so, oh, okay, so diagnosis of idiopathic epilepsy was made. Even grammatically it is okay, but commonly we don't like was made. I would prefer, and idiopathic tonic-clonic epilepsy was diagnosed. Would look very professional. And idiopathic tonic-clonic epilepsy was diagnosed. Would look very professional. Okay. Okay. Just I need 1 minute break. Okay. 1 minute break and just see here. If there is any mistake, just point out. I need to see a patient. Coming back very soon. Okay. So then today, and again here, we don't need to use both of these things. Today and the date also, just use one of them, okay? With anorexia and jaundice, however, there has been no episode of fit since her last visit. Her investigations show was okay, show high bilirubin and thrombocytopenia. She has stopped her medication for the last 2 days. I would be highly appreciated. I with appreciated is most not commonly used. It would be highly appreciated if you want to use it, okay? If you could review her medication and give further a treatment plan as necessary. I have counseled her to continue medication till she sees you. Is also not needed here. So you can mention if you wish, okay? Overall, doctor, your letter is good. Your letter is good. Just need a little bit more improvement to get a clear B, okay? You need a little bit more improvement to get a clear B. Now you are at the borderline, okay? Like 340, 350, like this at the border, okay? So you need a little bit more improvement. Okay, so Rafia Mahmouda is there. Rafia Mahmouda is there. Rafi Mahmouda is there? Okay. So, Dr. Inam, do you understand? Just improve a little bit more things, okay? Okay, now. So here, let us see this letter. So first we will count the words. 220 is okay, but we can be a little bit more concise. Okay. I'm writing to refer Miss Jenkins. We need here hyphens here. Please be careful. Married lady who has been diagnosed epilepsy, she requires further review. Instead of requires, we can use more polite language. She would require is more polite language. We have medication and treatment plan. Okay, we can improve. Okay, we have not written side effects. You have not written, polite language. It can be improved. This is first presented to hospital. Not enough to hospital. Just presented on this day with complaints of it. If it is single fit, off it. Jerky movements of arms and legs. This is part of the fit. Okay. Loss of consciousness, tongue bite upon assessment, her oxygen saturation, blood pressure, pulse, and systemic examination was normal. There are a lot of things, and we cannot use was normal, is grammatically wrong. So this para sentence can be made it concisely. Her examination was unremarkable, very easy. Apart from that, certain blood tests, EEG and MRI of the brain were ordered. We don't need this. Some relevant investigations were ordered, and a review was planned after 3 weeks. Okay, make it concise. Upon our follow-up on this date, we can directly write on this date, Miss Jackson was experiencing previous type. Okay, fit, but we need to use the mentioned timing. Now it is more than 5 minutes, very important. Treatment injection, diazepam should be written small. Okay, although investigation were normal, ECG show progressive burst after this and that. That is good. Doctor recommends no. This is wrong. Okay, this is wrong. Okay, we don't need this. She was commenced. We need to use passive voice to make the things more, formal and easy for the reader. She was commenced on barbarate and was given advice, okay, on lifestyle like this. Okay. Miss Jenkins complained loss of appetite, yellow discoloration, skin and eyes, pale stool, and dark urine, which might be the side effects of. You don't need to show that which might be the side effects of this and that. Therefore, she stopped medicine for 2 days. She stopped. Okay, if you use it for 2 days, then stopped is not good. She has stopped medication for the last 2 days, or you can use she stopped medication 2 days ago. Okay, we need improvement. Beside that, her blood shows elevated. Okay, in the above circumstances, we don't need circumstances. In view of the above is enough. Okay, it would be greatly appreciated if you could review Miss Jenkins' medication. We need apostrophe here and treatment plan and provide further management as you deem appropriate. Not enough ED, just deem, okay, without ED. Overall is good letter, but it can be improved, okay? It can be improved. Miss Harsh is there. Miss Harsh, one of my VIP hybrid course student, Miss Harsh, is there? Yeah, you are there, okay. Okay, I'm ready to refer Miss Jankin, who has been diagnosed with chronic idiopathic epilepsy. Your assessment and management would be highly appreciated. You people can see from this that does not show what we want from the reader. It shows mean it looks like we need, some review of, some management of idiopathic epilepsy and nothing. Does not show that patient is having some side effects of the medication. We need medication review. It's not clear. Okay, don't make it too vague purpose. Okay, I have already discussed these things. 1 meter due to jerky movements of both arms and legs with visual and auditory auras, as well as all loss of consciousness. At that moment, her vitals were unremarkable and blood samples were taken for basic investigations. Okay. Initial EEG and MRI were taken. Were taken, no. They were requested, not were taken. This is wrong. Okay. Not commonly, we don't commonly use. She was advised to review after 3 weeks. We don't need this hyphen here. This hyphen is not needed. On this day, Miss Jenkins complained episode of a similar fit for 5 minutes, 1 week after her first fit, for which she was treated. She was treated with diazepam should be treated small. Okay. Her MRI revealed mass and EEG. No, you can see this is wrong information. Okay, this is wrong information. Her MRI is not showing any kind of mass. This is just misunderstanding. No, as I was using slash here between abnormal growth or mass detected. So means this no is for both of them. No abnormal growth or mass detected. Okay. So this no is for both of them. Okay. So you have written some wrong information, Miss Harsh. An EEG showed proximal burst of rhythmic high amplitude spikes. She was commenced on sodium valproate. You should need to mention the dose. Okay. The frequency is very important because we are talking about side effects. Okay? And advised to stop driving, working on heights and avoid, loud noises and flashing lights. You don't need to write each and everything. She was stressed to continue. Regular review. This is not also needed. You just skip it. Okay. Not it. Previously presented with loss of appetite, fever, yellow discoloration of skin, pale ear, stool, and dark urine for 5 days. A report showed increased level of bilirubin. Bilirubin should be small. Okay. And decreased level of platelets. She has started her medication 2 days ago. She has stopped. It's 2 days ago. It is wrong. This sentence is wrong. Okay. If she stopped 2 days ago, then don't use present tense. Okay. She stopped her medication 2 days ago. Has a family history of epilepsy, and she had been treated for bacterial meningitis. You can mention when she was treated. Okay. Continue her medication until your review. You can mention this here. Okay. But she stopped her medication 2 days ago. But I advised her to continue the medication till the review. Then write the conclusion. Overall, Miss Harshi is good letter, but it can be improved, please. Okay, can be improved. So, Dr. Deem, okay, I'm writing to refer Miss Chinnigan who has been possibly suffering from is not good. Okay, I already mentioned his side effect is happening. I would be highly appreciated. I would be highly appreciated is not commonly used. It would be highly appreciated. It would be highly appreciated is used. Okay. Uh, Even is not commonly used this expression in the purpose. Please avoid. If you could review her medication and treatment plan. On this date, patient presented with complaints of fever, poor appetite, this and that. She also had yellow discoloration of both eyes and skin. Her lab reports show again. People, you can see. I knew that some people will make this mistake. Okay, even he is a very good student. Lab, we cannot use lab word lab. Okay, we need to use the word complete word laboratory. Okay. So we cannot use abbreviation. Shows is wrong. She has stopped. Ah, this is today's visit. Okay, okay, okay. Sorry. Sorry. So you are written today's visit first, okay? So just write today here instead of writing the date. If you want to write today's visit first, just write today, okay? This is both eyes and skin. Lab reports show an increase in the bilirubin, decrease in frequency. She has stopped medication, okay? I had a first episode of it on this date. She was rushed to the emergency department, was managed accordingly. After 3 weeks, she complained of experiencing same episode of it 1 week after the initial attack, which lasted for more than 5 minutes. She was rushed to the hospital again. Don't use rushed again, please, okay? Dr. Nadeem. It makes no repetition. Was given a stat dose of, not enough stat dose, just was given diazepam. Don't need to write the details. The pathology reports were normal except her EEG report, which revealed paroxysmal burst of rhythmic high amplitude spikes. Made, and she was commenced on this. Okay, please use chronological order here. Don't use order of importance. It's not good in this letter. A significant family history of epilepsy in her father. This is not needed. This is not needed here. The case is already diagnosed. I believe Mr. Khan is possibly experiencing side effects of paracetamol. I would be grateful for your opinion regarding the treatment. Just if you could review her medication. Okay. So overall, Dr. Nadeem, I think you need a little bit, practice, please. Try to improve a little bit more, Dr. Nadeem. Okay. Your letter needs improvement. Even grammatically wise is okay, but it needs. And Leonora is there? Miss or Miss? Okay, no, we are female, yeah. Dr. Leonora or Miss Leonora is there? No? Okay, good. Dr. Nadeem, you need some improvement. Okay. Okay. DrChe. Okay. Here on separate line. Okay. Here we need Miss Sophia Jenkins. I'm ready to refer Miss Jenkins to you for review of her medication due to the same side, some side effects she have after she starts the treatment. Do you think, from reading this purpose, do you think this student is new to OET or is old student? What do you think? What do you think from after reading this purpose? This is a new student or is old student? What do you think? What do you think? Looks new, yeah. Looks new. Yeah, yeah. Okay. So we need improvement. New to OET. Okay. Means it's not typical OET style, Mr. Okay. Means it's not typical OET style that we commonly use. Okay. I'm going to refer Mr. Anakin to you. Even not need of to you. Okay. And we have not written the diagnosis here in the purpose. There is no diagnosis in the purpose. Okay. So which treatment? So just needs improvement overall. The purpose needs improvement. So you can see what we have discussed so far, many, letters. So I have shown you my model answer also. On this date, we need comma here and we need name of the patient here. Okay. Presented to us with signs of epilepsy. So we don't need to write the signs of epilepsy. We need to write which were the signs. Okay. Just write the signs. Don't write directly it was epilepsy. So she presented with a fit that lasted for 3 minutes, and she had auditory and visual auras, and she also had loss of consciousness. She had also urinary incontinence. She also, there was one more thing. So just write them, okay? Don't directly write. She has signs of epilepsy, okay? On the examination, vital signs were at normal. Just her examination was unremarkable, very easy. She was referred to review after 3 weeks for LVC, FVC, EFT, and so on, and MRI of brain, EEG also. Just write some blood investigations, EEG and MRI were ordered, okay, were requested, were ordered. On this date, she knew Miss Jenkins presented with similar signs, just episode of fit, okay. She was in the first time she was treated, okay. It does even all the examination of the FBC, just our blood investigations were normal. You can write FBC, this were normal. He show paroxysmal burst. Okay, this was diagnosed with monoclonal epilepsy. We don't need to write them capital. We need to write this in small. Okay, we only write in capital if the name is, you know, if the name of the disease is given after someone's name, like Parkinson's disease, Alzheimer disease, and she start. This is past visit. We cannot use start. Okay, is wrong. She started treatment of sodium valproate. Okay, she was commenced on sodium valproate. Like she was advised to stop driving, avoid no loud noise, and regular review with GP. On this date, she presented with skin and eyes, fever. Fiver, no, fiver is to earn money. Okay, fiver, money. Okay, loss of appetite, dark urine. Just typing mistake. Okay, I'm not just joking. Okay. Investigation was increased. On the investigation was increased, tests were decreased. Stop medication. Okay, so overall we need a lot of improvement. Okay, what you need to do is, Miss Leonora, what you need to do is, when is your exam? Yes, you need to send me a text and I will send you the model answer. You need to write this letter again. Okay, what you need to do? So after you compare the letter with your my model answer, so you will send me a text. I will give you the model answer. So you will rewrite this letter and you will send me again. I will mark again. Okay, then you will see the improvement. Okay, you will see the difference. You will see the improvement. It needs a lot of improvement. Okay, Dr. Hasita Sri Lanka from Sri Lanka is there. Mr. Ryanan, do you know? I knew it is from the purpose. This is a new student. Yeah, from the style of writing. You know how many letters I have marked so far. Okay, if you only see here this folder, sorry. So if you see here, this folder has 745. 745. These are the letters when in the course my students send me in the Word file. But there are many, letters that I mark in the picture. Okay, I just gave them 745, and it is just in the last 6 months. Okay, these are just that my students have sent me in the Word file, and there are many more in the picture forms. And here in this folder, I have 45. In this folder, I have 73. These all are in the last 6-7 months. Then we have all of these letters, 200 students. So each of the students, sometimes 2 letters, some people have 10 letters, some people have, 5 letters. This was at the start. Okay. If you see in the downloads, these are, when I download the letters from my WhatsApp. Okay. So for example, let us see. Last week, okay, there were 93 downloads, many pictures. These are pictures or letters, for example, like this. This is the letter. So my students send them in the picture. So all of these are letters. Okay. If you go here, 2680. Maybe there are 2000 letters, but overall, some other things could be also, but at least would be 1500, more than 1500 letters. Okay, so this is with time and experience. Okay, not like this. Okay. So Dr. Hasita is there? Yeah, okay. Thank you. Okay, so Word count is 215. Okay. Thank you for seeing Miss Jenkins, a 70-year-old teacher who is diagnosed to have with narcotic, who is diagnosed with tonic-clonic idiopathic epilepsy. Believe me, people, why I am using this tonic-clonic idiopathic epilepsy in capital? Why? Just to check whether you will write this in capital or small. This is diagnosis we need to write in small, not in capital. Okay. So it should be in small. Okay. Who was diagnosed with tonic-clonic epilepsy and requires your expert opinion for review of our current medication? We can improve a little bit more your purpose. Okay. Was brought on this state by an ambulance with jerky movements of both arms and legs with loss of consciousness and voluntary passing of urine and tongue bite for 3 minutes. Okay. This for 3 minutes does not fit. Okay. Because looks like the tongue bite was for 3 minutes. Okay. 3 minutes should be with jerky movements which lasted for jerky movements of both arms and leg which lasted for 3 minutes, then associated with loss of consciousness and voluntary passing of urine and tongue bite. So these 3 minutes don't fit here at the end. It should be with you know jerky movement. It was preceded by visual energy or auras, even though she had normal examination finding. A review was planned in 3 weeks. We can make it a little bit more simple, easy. She, with the name of the patient, had another fit for that lasted, okay, for more than 5 minutes. It lasted for more than 5 minutes. Diazepam was given very simple sentence. We can join them together, these two sentences, for which intravenous diazepam was given, for which she was given, diazepam like this. Biochemical investigation, we done it biochemical, laboratory investigations and MRI. And we cannot use was here is wrong. Okay, were, because there are more than one things. But EG showed worsening this and that with the diagnosis of tonic-clonic epilepsy. Again, it is written capital here. It should be small. Okay. She was prescribed sodium valproate 300 milligram twice daily with lifestyle advices. Advices we don't write in plural, is uncountable. And regular visits were planned. Okay, good. After 1 month, we need comma here. She had features of jaundice for 5 days and stopped her medication. She had elevated bilirubin and low platelets, although our side effects are suspected. So here we need some helping verb. Okay, is wrong. Okay, this part is wrong grammatically. She was advised to continue it until neurological review. Jessica had episodes of treated with antibiotics. She has no, these things we can even skip. Okay. Okay, doctor, that's good letter, but it needs improvement. Okay, it's good letter. Your English is good, just you need to little bit improve to write in typical OET style. Okay, typical OET style. You need to follow typical OET style. Susan, Miss Susan Shaju is there. Miss Susan Shaju is there. This person, number 7. Just Dr. Sita, you need to just use a little bit typical OET style. Otherwise, you are good. Okay, you need to follow typical OET format. Okay. Miss Susan Shaju is there. No. Dr. Sama Nahid. No. Okay. Dr. Sama is there. Okay. I'm writing to refer Miss Jenkins. We need comma here. A 27-year-old woman who has features consistent with tonic-clonic epilepsy. She requires review of her medications and further treatment plan. Okay. Miss Jenkins is a teacher and has hobbies of swimming and dancing. She has a history of allergic rhinitis for which she takes loratadine. This is not needed. Okay. This is not needed. Her father has a history of epilepsy. This is okay, but I will also say it is again not important because the case is already diagnosed. This is presented with fits which were lasted. It was single fate. Okay, we cannot use as plural. Which lasted, which were no, which lasted For 3 minutes, associated with jerky movements of both arms and legs, loss of consciousness, tongue bite, and urination. Urination, no, she passed urine like this. Urinary incontinence like this. She reported auditory and visual auras before fits as well. So overall, your organization can be improved, Dr. Sama. Okay, organization within the paragraph, as I have discussed. Some relevant tests were ordered, and a review visit was scheduled after 3 weeks. Upon a review visit, Ms. Jenkins presented with a complaint of fits after 1 week of first fit. Complaint of fits after 1 week of fits. It needs improvement. Typical, use typical style. Okay, sure, charisma, this and that. She was convinced on this. Today, Shenska presented with a 5-day history of fracture, this and that. Okay, she says she stopped. Had stopped, or just stopped. Okay, use past simple. Good evening, Miss Shiva. Okay, so however, she was advised to continue medication till a review. Okay, so Dr. Sama, overall, your English is good. English is good, and you need a little bit typical OET style. Okay, you need a little bit typical OET style. Okay, you can easily get B grade. Okay, you need improvement. Okay, please. We have discussed a lot, about the, letter. You have seen the model answer also. You can improve. Madiha, Miss Madiha. But this is not B grade, Dr. Sama. Needs improvement, please. A little bit more improvement. You can easily get your B grade. Miss Madiha is there. Miss Madiha. Miss Madiha, Miss Varuni. I think is enough. We have done, 2 hours of class. It's not easy. Any of you is here, Miss Madiha, Miss Varuni, Mr. or Miss Moise, Miss Susan. Any of you is here? Okay, thank you, all of you. So if you have any questions, you can ask me on my WhatsApp. Just one last thing before you leave. So we have VIP hybrid course. Just 1 minute, please. Okay, so we have VIP hybrid course for writing, in which I mark your 14 letters. There would be daily discussion of your letters. Your letters will be marked by myself, all the letters. You will see my model answers for all the letters. 3 referral, 3 urgent, 3 discharge, 2 letters to non-medical professional, 1 pediatric patient. In one, there would be 2 patients in 1 letter. 1 GP to GP transfer. In case of nurses, is 1 community nurse to other community nurse. Okay. So the duration of 14 days, and mostly after you finish these 14 days, I continue. I keep helping my students till their exam without extra charges. So 100 GBP is the price. After 30% discount, you can get in, 70. If you want only writing correction, per letter is 5 GBP. Okay, it's very affordable prices. So thank you so much, all of you. See you in next free class. Okay.